Hey friends, welcome to another episode of Ask Nurse Alice, the show that talks about all things health, wellness, love, lifestyle, and everything else you want to know, and without a copay. So we are going to roll right into things because we have such good information to talk about. And I think this topic is going to be, ladies, this is going to be a topic that you can watch with the fellas. Fellas, you won't have to walk out the room. It's all good because actually you're probably going to want to be in the room, definitely for sure, because we're going to be talking about COVID-19 and NBA basketball. It's all about the basketball. And this is something that, we've been missing. We started basketball season, but got sidetracked by this small little thing called COVID-19, right? And so we're going to get to the conversation and talk about this. But before we do, guys, make sure that as we're talking about this, that you don't miss another episode. You can stay tuned, get alerted when things come up. Please make sure to go to youtube.com/Ask Nurse Alice. Make sure to subscribe. Also, like some videos while you're there. Share it with your friends. And as well, you can watch this on all podcast platforms, whichever one's your favorite. Look for Ask Nurse Alice, and that'll definitely be there. Shout out to Inclusive Media for being the machine behind this show. They too want to make sure that you get the important health and wellness information. And my folks in the room, Theo and Alex, yes, I don't have a mask. They are here helping me, but they have masks on and they are more than 6 feet away. So I just wanted to establish that because I know you guys want to say, Nurse Alice has been talking a lot about these masks and she don't have hers on. But no, we are definitely taking the precautions and hand sanitizer on deck, all that. So I don't want to hear it. But let's get to basketball. And you guys, you know that I always bring it, right? I have the best of the best of the best. I have my super friends, my healthcare experts, my celebrity friends. I'm bringing them all to you. I'm sharing my expertise with their expertise to you, with no copay. And if we're talking about COVID-19 and basketball, I thought, you know what? Who am I going to have that's going to have, really know this? Who is going to be the expert on this topic? And I'll tell you, it didn't take me long to figure it out. And if you don't know him already, you're going to get to know him. You're going to get to know to love him, and you're going to want to follow him because I am bringing to you Dr. Brad. And listen, he's got a long resume, so let me make sure that I get it right because I need him to get all his proper kudos. I'm bringing my super friend to you guys. This is Dr. Brad Bellard. He is a double-boarded sports medicine physician in Dallas, Texas. He specializes in helping individuals with joint pain by using regenerative medicine procedures to help them return to their active lifestyle without undergoing surgery. He's worked with multiple professional teams, including prior service as an assistant team doctor for the NBA Dallas Mavericks. He's a regular guest on the weekly Dallas ESPN show, Inside Sports Medicine, where he educates and entertains local listeners about sports medicine and all related topics. So who better than Dr. Brad? Welcome, Dr. Brad.
What's going on, Nurse Alice? How you doing?
I'm good. How about yourself? How are things in Texas?
You've seen the numbers. So, things are rising here in terms of COVID, but other than that, I can't complain. I appreciate you having me on the show.
Thank you so much. And I definitely wanted to bring you on the show because, I know people, COVID's changed lives drastically,
Yep.
Jobs, family, where we pray, where we play, all of those type of things. And one of the things that people really, really want to get back to is having some type of normal activities in their life, some normalcy. And what more than watching one of our favorite pastimes, basketball. We started the season and got interrupted. And now listen, Dr. Brad, they're talking about, and they've actually started the process, and I'll ask you to kind of bring us up to speed with things, but they've started things, put things in motions to start an NBA season. So can you tell me and the viewers what's been going on with the NBA and what have they done so far?
Yeah, so back in the springtime when COVID first started, there were a couple players who tested positive. I believe Rudy Gobert, who was one of the big men, he was a center for the Utah Jazz, and one of the other guys on the team, guys started testing positive. At the time, with all the risk and us just trying to figure this thing out, they went ahead and shut down the season. and the NBA season has been shut down the entire time. Now, that affects a whole lot of things just in terms of the National Basketball Association, because usually by now we would have had a champion and we'd have had the playoffs already, and the season would be over. We'd be in off season right now. But because we weren't able to have a champion, because we weren't able to go through the playoffs, the NBA is now trying to figure out a way, despite the COVID crisis and everything that's going on, how can they still have a playoff and finish the season in the safest way possible? And to be quite honest with you, I don't know if they have the answer. I don't know if anybody knows what the answer is, but they have started to. They have a program that they're basically calling the bubble, and they are bringing teams, inviting the teams to Orlando and Disney Wide World of Sports, and they're basically trying to have one place where all the athletes are going to be for a certain period of time and have limited access during that time to try and prevent the spread, to try and prevent actually COVID getting in the bubble.
But wait, Dr. Brad, is this really a bubble? Because I'll be honest. I mean, I'm familiar with basketball. I know Disney World. And I was just thinking, like, are they really going to be actually in a bubble? Or is that just a terminology that they're using, as you described, to kind of say that only certain people are going to be in this area? Is that really what that is? Or is there really a protection?
Yeah, no, that's a great point. So theoretically, it's a bubble, meaning they're trying to contain things as much as possible in terms of COVID either getting in, and if it's in, being able to manage it if it happens to get in there and quarantine folks and just kind of have everything in one place. So teams have already started to come over the last few days. They're bringing teams in waves. But the problem is, as they started testing teams before, because what their thought process is, if we can test guys before they make it there, then we can have guys quarantine before they get there. We can limit the amount of exposure coming into the bubble. Gotcha. But what they started seeing is that guys, somewhere between 20 and 30 guys have already tested positive before we've started the season. So there is question of whether we have guys who have yet to test positive are already there or coming there, when they were tested negative at first and still may be positive, or may acquire it on the flight there, or may have, some way between where they are to getting to the bubble that they may have acquired it. So it's just so many moving parts. I mean, it's extremely difficult, but I'm sure we'll get into it.
Right. So you're right. And because of the incubation period, right, once exposed, anywhere from 2 to 14 days, and there's so many variables and so many opportunities for players, staff, to get it. And then also there's the people who work in the facilities that the players will be at. But I want to say, a very noble idea for the NBA. If they could figure this out, I hope that they would talk to our government, because we seem to be having a problem nationwide, but it seems like the NBA thinks that they can accomplish, containing COVID-19. And I understand that there's a 113-page document where they actually outline all of the things that they're going to do. Dr. Brad, are you familiar with some of the things that are in there? And do you think it's actually realistic, the things that are all in there?
Listen, as I talk, I'm going to try to separate my opinion from what's going on.
Well, that's okay. You're the expert, so we really value you.
Here are my thoughts. The 113-page document is there to make sure that they said that they've tried to dot their I's and cross their T's. I mean, that's why it's 113 pages.
So nobody reads it.
But even if someone reads it, we've got players who are already saying, Joel Embiid came out, Damian Lillard came out and said, look, even if I try to do this, I know guys who won't adhere to this. They've already said that guys can actually leave the bubble, which is leave off of the campus. But if they come back, they have to be quarantined for 10 days. They'll be able to go to certain restaurants that will be closed down just for them. To me, as long as we continue to extend the bubble, there's just going to be more possibility. Not to mention more possibility that COVID could enter. Not to mention it's in a state where, the numbers are rising. So
Absolutely.
I think about this bubble that has a whole lot of holes in it, and I just don't know if it'll be able to you know I mean, look, we talked about this just before we got on about whether the season will start, whether
Yes.
this playoff tournament will start. My thoughts is it's about 50-50. There's so much time between now and then. So many things can change. Things are changing on a daily basis, and they're going to be testing guys every single day as well. And then once it starts, it's hard for me to think that we're going to be able to have somebody who's going to hoist the championship trophy. And what is that going to mean whenever they hoist the trophy? I mean, I just it's hard for me to say that, okay, this champion is an actual champion, considering we got guys who are choosing not to come to play. Guys have said, you know what, this is too risky for me. Avery Bradley, some other guys. I mean, these are key players on a team that can contribute, and they're deciding not to. Right. What happens if LeBron tests positive and he's out? I mean, the Lakers are pretty much done at that point. So, I mean, even if these guys, even if somebody like the caliber of LeBron does not test positive, if anyone tests positive, that means you're now down a man. You have to change the way you play. And the question is, I mean, would the real true champion be the person that hoists the trophy? There's too many questions to me. There's just too many questions.
Right. And so, Dr. Brand, as you mentioned, this is all happening in Florida. If I remember correctly, when I was reading and kind of keep up with this, that, one of the first few days when players were coming, that's when Florida was seeing its highest peaks in, positive new cases for COVID-19. It actually seems very dangerous. It's almost like we're sending our young, healthy athletes into the belly of the beast, all for entertainment purposes. So my concern is that, every life is precious. I don't care if it's a staffer, it's LeBron, it's one of the coaches, but I feel as almost that we're endangering some of these players for the sake of sports, something that's elective. While, we do enjoy sports, there's this money that's behind this machine, I think is terrible. And I'm so glad that some of the players have actually said, you know what, I'm going to sit this season out because it's not worth it. Now, getting back to the document, if I understand correctly, and correct me if I'm wrong, that players who choose to opt out because they are concerned about safety, will they be penalized? What happens to players if they decide they don't want to play? How do they determine who's at high risk, so they've been excluded to play? Can you tell us more about that?
Yeah, so guys who just choose not to play, who say, listen, I think it's too risky for me. My understanding is that these guys don't get paid. Now, there are physicians that are going to comprise a committee that will look at players who may have comorbidities such as asthma or, heart condition, something that might put them at risk of not doing well if they get COVID. Mm-hmm. And they'll look at the person's or at the player's medical record and see if them opting out because of medical reasons is legitimate, basically. And if they decide that person would be at greater risk and that they shouldn't come, that person continues to get paid. That's how
declined? What's that? I'm sorry. What if you're declined and said, if they've declined and say, no, you're eligible to play, but I understand there's a process also for players to appeal that.
That's right. So they can appeal the process if they feel like their medical condition is worthy of, being able to sit out.
Okay. Now, all of this testing that's happening, so a player's going to come, they're going to get frequently tested, they're supposed to be quarantined. It sounds like a lot of work, a lot of resources are going into this, especially at a time where we have pockets in the nation that don't have enough testing, that don't have the money to do these things. Do you think the NBA is, for the most part, going to actually be able to adhere to all of the standards that they set into this document? I mean, if someone comes out or if someone has a fever, they get quarantined this amount of days. If they expose their families, their family members also have to get quarantined and tested. Like, isn't this a little too much? Is this really worth the sport? watching the sport? I'm just saying. I mean, listen. I know
Well,
some people are gonna say yes, but lives are important here.
it depends on who you ask. If you ask Adam Silver, who's the league commissioner, he's probably going to tell you, yeah, it's worth it. If you ask some of the viewers, they're probably going to say, may not be worth it, depending on how bad they miss basketball. You know, it's interesting. Fred Van Vliet, he's a guard for the Toronto Raptors. He said, about a month ago, this all seemed kind of cool, but now that we're here, this doesn't. I'm kind of worried as we're starting to enter this thing. Look, there's questions that we need to be able to answer that we can't answer. Right. One of the questions is, if you just talk about worst case scenario, let's talk about worst case scenario.
Okay.
That a player tests positive, and let's just say they end up being hospitalized or in an ICU on a ventilator. Is the NBA willing to take that kind of hit? And say, you know what, we went through all of this stuff to really practice what is a double standard based on what society is, because everybody's not getting daily testing to go to work. Right. So, there's a double standard there in terms of how they're treating it. But like, what is, worst case scenario? Is it worth everything that we're doing? And depending on who you are, I would say most people are probably going to say, you know what, I don't think it's worth somebody going to the ICU, much less someone, unfortunately dying because of this, whether it's an athlete or a staff member, because we cannot stop people who are outside the bubble, who may work there, yes, or who may have some sort of touch point outside of the bubble that could get things in. And, this thing is invisible, man. I mean, people testing positive every day. Some people are asymptomatic. I mean, it's just this invisible, potentially deadly thing. And so is it worth doing all of this? In my humble opinion, I think no. However, there are dollar signs that, influence a lot of what is happening. I can't imagine the type of money the league is missing because of this. I can't imagine. Right. And, and because of that, I think we're starting to, push the envelope a little too much. And you see the players extremely concerned about it.
They are extremely concerned about it. And that's actually where I wanted to go next. I mean, as far as a player's readiness, there's the physical readiness, there's mental readiness, the technical preparation and all of those things that need to happen. I can't imagine that there's not an added layer of stress because you are entering into an environment, going to a state where you have increased cases of COVID-19. You're being quarantined, separated from your families. You have some people not playing, so you have new players entering. You've not had kind of the synergy with these teammates. I mean, how are those things going to influence a player's ability to actually perform when they're on the courts?
Yeah, so this is what we do, me and my partners do as sports medicine physicians, is that, we treat athletes who are injured. The reality is that they've been off for months. And a lot of people say, well, them being off, isn't this no different than, being off, in the postseason whenever the championship happens and they have the postseason? Well, no, it's actually completely different, because in the postseason, guys play in summer leagues. They're still staying in shape. There's been no leagues other than maybe, one-on-one basketball, one-on-none basketball, meaning, you've got the trainer sitting there throwing you some passes, getting some shots up. There's a completely different, level of play whenever you're playing every single day. And to go from, relatively sedentary, and I'm not saying they were sedentary, meaning that they were just sitting at home, but to the level of basketball that they're going to play based on how active they were, yes, there's a relative sedentary component. And to go from that to now going full speed or trying to get in shape in 3 weeks for this, with the added fact that you're not going to be seeing family for a while because family isn't going to be able to come to the bubble until the playoffs start. They have to be quarantined for 48 hours in their own room once they get there. That's already enough mental anguish. People can't probably stay, by themselves for a day, so now they have to stay in their room. There's so many different added things that is going to contribute to mental fatigue, potential physical injury. in Major League Soccer, they had a record number of cases of soft tissue injuries, meaning muscle strains, tendon ruptures, all kind of stuff, whenever MLS came back, because these guys went from, again, relatively sedentary to playing, trying to play at 100%. So don't be surprised if guys start dropping. And we already got to anticipate that some guys are going to drop because some people are going to be positive. So again, how are we going to fit? You know what I'm saying? Like, these are things that we have to consider. And I'm telling you right now, as a former assistant team physician for the Dallas Mavericks, I can tell you the trainers are stressing. The guys who are trying to get these guys in shape, the staff, the sports medicine staff, they're on the lookout of guys cramping up, guys having, Achilles ruptures, guys having strains that are going to keep them out anyway. Because I can tell you, you get a bad hamstring pull, COVID or not, you're probably not going to come back to be able to play.
Right.
So all of these things are contributing to it. It's not just COVID.
Now, Dr. Brown, you raised a good point. So you said the trainers are stressing. Now, let me just say, not to blame anyone, but we, the public, are aware that sometimes sports physicians, not you, of course, have not always been on the up and up. We know that the NFL denied, concussions for such a long period of time. These players had to really fight for health benefits and things like that, the protections. We know, and even in my own limited knowledge of basketball, in the playoffs, Kevin Durant, should he have really played that game and, sustained that injury, or should he have just gone on sat out? But the doctor cleared him, and then it was Kevin Durant's call. So I'm just saying, when there's money involved, my concern is that people may not always be forthcoming. And I'm not just talking about the physicians and the trainers and the coaches, but the players themselves. Like, you have people who are now going to be playing that weren't playing before. Maybe they're like, wow, this is my shot. This is, I'm going to get those, this is my time to make that money, lots of money riding on in these games. So what do you say to that? I mean, how can we ensure that there's going to be some, transparency and truthfulness so that people are doing the right things? Because the last thing we want to see is a player unnecessarily injured who continues to play, or a player who is COVID positive and continues to play because maybe somebody fudged their tests or they didn't report the right symptoms. I'm not saying that the NBA is going to do that, but when money is involved, it's not that hard to look the other direction. What do you say to that?
No, and so when you think about somebody like a LeBron James, me and my partners talked about this before. If LeBron James, ends up being positive, in essence, he's the face of the league. Right. Everybody's going to be watching, whenever this playoff starts. Is it the league's best interest to share that? Or to be able to have him continue going, depending on if he's asymptomatic. If an asymptomatic LeBron gets a positive test, so that's something that you have to consider. I would hope that there is a high level of integrity for those who are making decisions, and that these positive tests, that there's some sort of objectivity to it, that there's either an outside source that's, doing the testing and saying who's positive, and it's not just all, driven by folks who are, on the staff of NBA. Right. But we've got that part. Assuming that they do report the test, I can tell you from a physician standpoint, we would not be able to let the person play from a COVID stance. Now, you talk about injuries, now it's a little different. It's our responsibility as sports medicine physicians to be the player advocates for health and safety, really is what we are. And so if there's a potential injury, we have to sit down and have a discussion about, hey, this is the injury. This is the likelihood of it getting worse if you play. And basically coming to a conclusion of risk versus reward, and making sure that everybody is on the same page and saying, listen, this is a risk of the injury that you have. Are you willing to incur that risk if you get back on the court? That's a conversation to be had depending on the level of injury. Oftentimes we say, look, this is just not going to work. You're not going to be functional. You're going to hurt the team more than you will help them by going out there or your career. So I would hope that, the medical staff would have a high level of integrity. I know when we took care of the Mavericks and my partner took care of them for over 22 years, that's how we did what we did. And, for the sake of something that's as important as COVID, let's hope that the integrity of, positive tests that are being told actually get told, even if LeBron is positive.
Right. I hope so too. And so, again, this has been a great conversation. I know we can go on forever, but Dr. Brad, I have to leave on this one question. So with everything in mind, what are your predictions on whether we will able to start or finish an NBA season? Because headlines today read, NBA Commissioner Adam Silver concerned wave test inside bubble could stop the restart plan. So what are your predictions on whether we're going to be able to start or even finish this season? If we get
I'm going to get to that answer. Here's the problem. Here's the biggest problem of the 113 document and the question that has yet to be answered. How many positive tests are enough to shut down the season? That has yet to be determined. No one can answer that question. Adam Silver's not answered the question. Is it 1? Is it 2? Is it 20? How much? And they're basically saying they're going to keep an eye on it. Because the reality is this: if they say a number and it hits it, they're going to have to shut it down. If the number is too high, they're going to be like, the percentage of people who are positive here is far more than the percentage of people who are positive in the United States. Why are we continuing to make this happen? So it must be ambiguous right now because there's no answer. There is no answer. There's no answer. In that 113-page document, it says if they increase and if it's more than what we expected, because they've already said, they got a little clause in there that says, we expect positive tests. So when you look back at when this started, it was less than a handful of positive tests that shut down the season. Now, numbers are higher than they've ever been. We're going to a place where it's hot, and we're saying now we know they're going to be positive tests, but we're not going to say when or how many tests need to be positive in order for us to shut it down. So I don't know. I mean, what do you do with that? So with that said, I do not believe that we will have a champion at the end. I am about 50-50 that we'll start the season, but I'm not very optimistic. I feel like there's a certain amount of this is being forced. Again, this is my opinion. If you go to the worst case scenario, again, somebody get admitted to the hospital ICU or, God forbid, even death, I would hope that it wouldn't happen. But are you willing to take that kind of hit? Is it that kind of hit? I doubt that the league is willing to. And if somebody gets really sick in the middle of this thing, I mean, to try and make this season happen, it would not be a good look at all. And I don't know if they're willing to take that hit. They might be losing money now, but, again, risk versus reward, what is it going to look like if something like that happens? So I'm about 50-50 on whether it'll start. And then I'd probably say I'm about 85% positive that no one will hoist that championship trophy. And even if they did, I don't know if I would consider it a real championship.
Right, exactly. I'm with you on that, Dr. Brad. I actually would rather that they not start already considering the information that we know now. I feel like the money, the resources, the risk is too much. Even one life is too much. And we've already had guys test positive. And what about the staffers? What about the people in the facilities? Like, we're just putting too many people at risk for something that is elective. So, you dropped some gems on us. Thank you so much for that today.
Now let me say this real quick, sure. Nurse Alice. We're talking about basketball right now. We got football coming up, and football seems to be, trying to go as if everything is okay. They're gonna have to answer the same questions. Let me tell you something. They're gonna have to be able to answer the same questions. And if you look at MLS and the fact that FC Dallas, one of the MLS teams, they completely dropped out of the whole team dropped out of going back to playing because it was too much. Yeah. And they're playing on a field. They're outdoors. I mean, it's very similar to NFL. So, I mean, I'm curious to see how the NFL will answer the same questions I'm talking about. How many positives until we got to shut it down? And are you willing to incur what is the worst case scenario if a staffer or even a player gets admitted to the hospital, unfortunately gets into the ICU on a ventilator or even death. And I just don't think they're willing to incur that. So I'm curious to see what's going to happen and how it's going to pan out as the NFL starts to try to have a season.
Right. I'm pretty sure they're going to be watching the NBA very closely for tips and trying to learn from those lessons. And hopefully, as we attempt to start an NBA season, no one gets hurt, that there are no further infections. Obviously, that is on my wish list, but we'll see what happens. But again, Thank you so much, Dr. Brad, for all this wonderful, wonderful information. I knew I had the best person to interview on this. I did. Again, guys, this is Ask Nurse Alice, the show that talks about all things health, wellness, love, and lifestyle, and all the things you want to talk about with no copays. And you have it here. We had Dr. Brad talk to us about all the things you wanted to know about why the NBA and if the NBA could start a season. So you heard his predictions. I'm not a betting woman, but I would bet that what Dr. Brad said. That's what I'm going with. I'm going with what Dr. Brad said. Dr. Brad, real quickly, can you tell our viewers where they can find you, learn more about you, connect with you, and all those type of things?
Yeah, sure. So for my medical practice, they can follow us on Facebook or Instagram at Texas Sports Medicine. And they can also follow me on Instagram, Facebook, and LinkedIn at Dr. Brad MD.
Okay, wonderful. Guys, so make sure you follow Dr. Brad. He's amazing, amazing, amazing. And again, we want to hear from you. Please make sure to follow us on all platforms at Ask Nurse Alice. If you have a health, wellness question, slide into those DMs. No unsolicited pictures. We're not doing that. Not for 2020, not for never. And then also, hopefully we'll be able to talk about one of your questions. So follow us on youtube.com, Ask Nurse Alice, on all your favorite podcasts. And again, thank you so much for watching. Make good choices. Wash your hands. Take care of one another. And until next time, live well, my friends.